webinar series with the University of Minnesota Extension's Community Development Department. I am Holly Arp, Leadership and Civic Engagement Program Leader with the University of Minnesota Extension, and it's my pleasure to kick off today's webinar on starting small to innovate and scale up. Before we begin, there's a few housekeeping items. The webinar is being recorded and the final video will be posted on our website. The webinar does have closed captioning option if needed. You see that at the bottom, and if you need anything, reach out to Brandon or myself via chat. And as a friendly reminder, please be sure to keep your microphones on mute when not speaking. And if you have questions or comments during the presentation, please feel free to drop those in the chat. Again, you may also send a private message to myself or my colleague Brandon Hofstad at any time. And then as we begin today, I just want to acknowledge that the tension and the grief that folks in and around Minnesota are experiencing, and we really hope that all of you are also taking the time to care for yourself at this time. We know that's also impacting our speaker, Kathy Quick, as she lives right around where some of the things are happening. For today's CD Exchange, I'm excited to introduce to you Dr. Kathy Quick, Professor and Gross Family Chair at the Humphrey School of Public Affairs, Academic Co-Director of the Center for Integrative Leadership, and our State Specialist with Civic Engagement in the Department of Community Development with Extension. Dr. Quick's work focuses on bringing people together with diverse perspectives to address high-stakes, complex, and often contentious public policy challenges. Her work utilizes ethnographic research methods to identify practices and processes to improve or impede equity and inclusion, and translates those insights into teaching, facilitation, and applied work with graduate students, community partners, including collaborations with tribal government, public, nonprofit organizations, and international research work. Dr. Quick brings extensive work as a practitioner to her scholarship, having previously worked in environmental advocacy and policy analysis internationally, and in the community development roles for local governments. She holds a PhD in planning, policy, and design from the University of California, Irvine. And today, Kathy will explore a structured process for starting small to innovate and scale up. The minimum viable benefit process is a strategy for agenda setting that can help collaboratives start up or adapt effectively to changing conditions. And with that, Kathy, I will turn it over to you.
Thank you so much, Holly. I'm very, very glad to be with all of you today. And I hope that this is provocative and helpful for each of you as you're prioritizing your work, as you're entering collaborations, managing collaborations, deciding when to exit from them. And I would really like to encourage some interaction today. So at several points, I will be asking some questions of you and encouraging you to enter some content into the chat. I will also ask that you enter any questions that you have about this material in the chat, and my wonderful colleagues, Holly and Brandon, are going to be monitoring that, and they will interrupt me if something needs an immediate clarification, and otherwise we will have time at the end for some questions and general discussion. But anyway, welcome everybody, and I'm really glad that you're here today. I'm very glad that you're here today. The theme today is about starting small to innovate and to scale up. And this is particularly related to work that I do with the Center for Integrative Leadership. So I want to tell you just a little bit about the center to contextualize that. Brandon, can you advance the slide? Thank you. I work with the Center for Integrative Leadership and have since 2010. And we are a university-wide center at the University of Minnesota. Our goal is to catalyze and to inform strong collaborative action for good by the business, government, and nonprofit sectors working together. And that is our focus. And that is how some of the methods and approaches that I'm describing today, how we derived those. But I would really like to encourage you to think about other kinds of boundaries that you may be working across. Possibly you work for a nonprofit organization and you work mostly with government. Perhaps you're from a government organization, you do a lot of contracting work with businesses. You may have, one of those boundaries, or it may be that you really are a tri-sector athlete, But I think that the tools that I'm sharing today will be relevant actually to people working in collaborative settings, even across departments within your own organization, for example. But our goal is really to catalyze that collaborative action across sectors. We were founded in 2006, and we are the only university-based center in the US, and in many ways, one of the only centers, period, that really focuses on that cross-sectoral interprofessional collaboration. And we are a collaborative effort ourselves of the Humphrey School, the Carlson School of Management, the College of Education, the School of Public Health, and the Law School. So a lot of this is also about professionals with different backgrounds learning to work together effectively. And so we offer graduate training, the Minnesota Young American Leaders Program, and lots of other community education activities and research. Let's go to the next slide. I just want to be clear, straightforward, honest, that integrative leadership is branding for our center. I think that you may have heard of this leadership referred to as cross-sector leadership, as shared leadership, as boundary spanning work of other kinds. But again, I think that there's relevance here, whether you are thinking about across sectors. It's really about how we bring together multiple players of different perspectives to really work on complex issues that are beyond the capacity of any given organization, sector, disciplinary background, profession, or geographic scale to be able to work on. Let's go to the next slide. And there are 4 reasons that we have really developed this approach and feel that it's really important. And I just want to recap those briefly to ground us. One is that indeed, most of the problems that we work on, the complex and very compelling problems that we work on, really do involve distributed authority, distributed resources that mean that there is the simple necessity because of our interdependence that we cannot address these without that kind of collaborative work. And so this is a really necessary approach for working on complex and compelling, significant problems. However, that doesn't mean that we're actually moving aside from the different interests, needs, or contributions of any given sector. This is not a kind of melding in the middle amoeba in which nobody is holding on to some of the things that initially motivated them to be attached to their sector or discipline. It's really about trying to bring those things together for good collaboration and outcomes. And let's go to the next slide. The second reason is that in our experience, this is a really good pathway for innovation. There is a lot of value in bringing those diverse approaches, those diverse skills, those diverse lived experiences, those diverse ways of knowing and motivations to a problem so that we can imagine different kinds of solutions and we can really work on what may seem otherwise to be really quite intractable problems through the benefit of the creativity and that exchange and combination of resources and views. But it's hard work to do. Let's go to the next slide. The third is that when we are working on many compelling and complex issues, that we actually need to work to some degree at scale. And here is the irony and the paradox of what I'm going to talk about today. The whole point of this webinar today is the notion that in order to get to large scale change, it's actually useful to start at a smaller scale. But even as I'm encouraging you to think about working at a small scale, that doesn't mean we lose sight of the largest scale. Right? We actually, in order to get to working at scale, get to working at making progress on really complex community issues, we actually do need that cross-sectoral coordination in order to get from our local efforts or our within our own sector or discipline or organization efforts to something that is more impactful. And that is more connected and combined. And that is the idea that lots of you are probably familiar with, the notion of collective impact, basically that we are trying to get at something that is greater than the sum of the parts. And the fourth reason, and this will be my first question to you, and I encourage you to enter some thoughts in the chat, is that we believe that cross-sector collaboration and effective collaboration in general is really a resource for resilience. And I don't know about you, but I'm definitely feeling some resilience challenges. This seems to be a season of resilience challenges. So I'd like to encourage you, please, to just enter into the chat. What does resilience mean to you? This is a term that's found across lots of different disciplines and sectors. And what are some resilience challenges that you are currently facing? So let's just pause for a moment and I'd love to see your definitions. And this is the participation section. where you enter some ideas into the chat if you're able. Hi, Shannon. I know your work, so hanging on to that hope is an act absolutely of resilience. Ability to bounce back is a very common definition of resilience: durability, flexibility, right? Adaptability. Systems being able to handle extremes. There absolutely is like a threshold ecological sciences view of resilience too, that it's like the ability of a system to sustain no matter what, or simply to survive. Being stretched too thin as a resilience challenge. Lots of language here I see about adaptability, right? Being able to grow regardless. These are great. Thank you very much for sharing these. Capacity to adapt. Yeah. Well, let's go to the next slide, and I will share my own definition of this, informed by quite a lot of very thoughtful scholarship by other people and examples as well. I really like to think about resilience not simply as an ability to survive, not simply as an ability to bounce back, not simply as an ability to sustain, but also really as an ability to reorganize knowledge, resources, practices, relationships, data, infrastructure, all of those kinds of things, so that we can move forward in a desired direction, even when we are experiencing severe disruptions or severe resource constraints, which seem to be a condition of our world at the moment. I prefer this definition because I think that there is a valence to the language of resilience that is often seen as uniformly positive. And there are some things about that that really bug me, frankly. Resilience is a very commonly used word. When I first started thinking about resilience, I did a Google search of it. There's a function in Google where you can see how commonly a word has been used historically. It has definitely been on the rise. It has had a moment, particularly, around 2010 through 2015. There was a lot of language of resilience, and it seemed almost always to be positive. But there are systems out there that are highly resilient that I would really like to see go away personally. And so there is this normative aspect of this definition that resilience is an ability to move forward in a desired direction. And it also recognizes the fact that there's a part of assumptions about resilience, like kids are resilient, that doesn't really recognize the burden and the damage and the harm and the hurt and the work that's involved in resilience. Even hope is a lot of work. It's risky. And so the reason that I bring this up in the context of cross-sector work is because I think cross-sector work is a resource for resilience, because it helps us to facilitate this learning. It helps us to recombine our resources and try to move forward in a more positive direction. So let's go to the next slide. So this is where we really want to talk about starting small as a strategic approach to navigating the overwhelm, because I think quite a few of the resilience challenges that I'm seeing here in the chat from several people are really about feeling overwhelmed, right? Resilience challenges right now are about that need to continually adapt, that constant feeling of disruptiveness, or not constant, just a major disruption that you are currently or recently experiencing. Resource constraints, those kinds of things. It can be overwhelming. It can really be a test of our resources. And so here's the point of starting small, is actually that it is a tool for resilience, as well as innovation, as well as a matter of necessity, and as well as a way to getting to scale. So let's go to the next slide. So I'm just going to give you this example. I don't know how familiar it is to the work that you are doing, but let's just try this on for a moment. If you just think about the far-reaching impact of something like opioid addiction in a small town or rural community, in the regions where you live, it is a matter of our interdependence and necessity to think about this in cross-cutting ways, because of course it's not only the individual who is trying to tackle and wrangle with that addiction and suffering it, but also all of their friends and family who loved them, their employers, healthcare systems, if those are, pharmacies or healthcare workers, social workers, hospitals, doctors, all those folks for profit and not, who work with them, emergency responders of all kinds, law enforcement, EMTs, and the whole legal criminal justice system and courts. All of these folks are interdependent in some ways. And so when you try to think about attacking a problem that, like the opioid addiction, I bet that there's not a person in this call today who would say that that's not important, right? Who would say, oh, well, it just is what it is. I think almost all of us would say, oh, this is important. But then when you think about how to work on it, or if you are in fact working on it, it starts to feel kind of overwhelming, right? Or is it just me? I don't know. What are some of the signs of overwhelm? Or what are some of the aspects of overwhelm that you feel? I'd like to encourage you to enter those in the chat so it doesn't feel like it's just me who feels like working on something like this is pretty uh, challenging and overwhelming. But what are some of the signs or aspects of overwhelm that come in when you're trying to make progress on something like this? If you could just enter those in the chat. Yeah, absolutely. No clear lead on decision making, stuckness, competing priorities, don't know where to start, brain fog and shutting down. Oh, yes, right. Feeling like you can't stop doing what you're doing and do anything else. Wading through resources. Absolutely. Yep. The short fuse piece, too, right? I know for myself, I often feel impatience with other things when I'm trying to make progress on the thing that I care most about, but that's also a sign of burnout when I'm starting to lose my tolerance for other things. This is really good. Yeah, thank you. Coordination challenges, all these things in the chat are really, really helpful. Brandon, if you could advance the slide, I'm going to talk a little bit. Yeah, doom scrolling, right? Like it's overwhelming. What do? We want to learn, we need to know, but it becomes overwhelming, and fatigue, all those kinds of things. The motivation comes from recognizing this need that we need to work at kind of a structural level, but it just can really become like we become mired, right? We can really become mired in this complexity. So let's go to the next slide. It is really difficult. There are reasons that this kind of cross-sector work is necessary if you think about something like the opioid epidemic or childcare in rural areas or affordable housing or really just appropriate and available housing for people of all classes and needs. I'm sure you could think of a whole variety of issues, right? If you're trying to make progress on emergency weather preparedness or try to figure out how to make emergency response systems work or how to pay for rural roads or, um, controversial issues as well, right? It's hard. And so it is really challenging to do this kind of collaborative work because it's outside of organizational frameworks. And so we have to forge new boundaries and new bridges. There's not a roadmap for it. Every time I hear people talk about doing this work, I feel this like residual sympathetic fatigue because I've done the work myself. Just hearing people talk about the work of working outside these organizational frameworks, all that collaborative work, like I just feel tired hearing about it. And a lot of you on this call, I know, and I know this work that you do. Sometimes you don't have those personal relationships. Sometimes they're not in a good place. Sometimes you personally, or you, the institution you come from, or the identity and culture that you are coming from, there's a very good reason that you're not necessarily a trusted partner in that space. And just all of those relational work can be very, very challenging as well. It's also really hard to get from the idea, the ideals, the goals, the feeling of like, oh, of course we all care about opioid addiction, to actually getting into the nitty gritty of, okay, well then what do we do about it? What can we do about it, right? And all of those feelings of encountering the overwhelm. So let's go to the next slide. So, but we try anyway, right? We try anyway. We aim high. And so, what are some of the motivations that you have? And again, I'd encourage you to use the chat. And for those that find it a lot to process the chat and the conversation at the same time, I'll just hit a few details. But if you would enter into the chat, like what motivates you to give it a try anyway? Why do you give it a shot? Personal motivation and commitment. No one else is coming to fix it. If we don't, why not? Right? We care a lot about it. It's important. If we don't work on it, do we just stop and go home? The pleasure, right, of working with other people, getting some other perspectives, problem solving, some satisfaction in that. Yeah. A feeling of commitment, responsibility. Yeah. Bringing some other perspectives to the table. Thank you. Thank you very much for these. Caring a lot. Yeah, these are good. I really appreciate the growth mindset. That's a big part too of resilience and growing. Yeah. A highly motivated group here. So it's good to see your perspectives. Let's go to the next slide. These are some of the common reasons that we've seen at the Center for Integrative Leadership for that desire to like work at the problem, even when it is very, very complex and sometimes overwhelming. And many of these you've already mentioned. And I'm couching this in terms of an allure or an appeal of going big, because I want to put that a little bit in contrast and intention with the invitation I'm going to make in a minute for you to go small as well. Before I encourage you to go small, I want to name and reckon with a little bit of the allure of going big. One of them is that that we just feel that an issue is compelling and urgent. You know, how could we not go at it with everything that we have? Also, very commonly, this belief that we can't work on a really complex systemic issue unless we're working on it at a systemic level, right? It doesn't make sense to address something like intergenerational poverty or structural racism at a micro level when there is a historic, a geographic, a power context for that, that it doesn't feel right to try to chip away at something in small ways when there's some foundational issues that really underlie all of it, right? So there's a feeling that we have to work at a systemic level because it's a systemic issue. To a certain degree, also, I think sometimes we aim big and aim too high because it's really hard to not believe that all of our effort will not take us somewhere, especially when we're working collaboratively and a lot of people are investing time and resources and reputation and opportunity costs of things that they could be working on otherwise, sacrifices that people make sometimes for things that they really care about, other things that they don't do in their lives, where they put resources rather than other places. Sometimes we just have an optimism that, like, if we throw everything we have at it, surely something will change. I think that also is sometimes driven by funders, by our contracts, by also by the stakeholders, that we should go big or go home. And the fatigue that we have of like baby steps are just not satisfying. I can't tell you how many people I've had conversations with in the last few weeks in the civic emergency that we're having in Minnesota right now, who have said, I feel like I should be doing more, right? And it's really hard to feel like, where are we seeing the progress, right? Like, we should go big. Where are we seeing the progress? But a large part of the reason that we sometimes go big as well is just pure leadership ambition, right? Like, we want our work to have an impact. We want to make a change. We want to help mobilize something. So all of these are reasons that help us sometimes to feel like we want to go big. But let's go to the next slide. There are those also some signs sometimes that we've gone like a little too high or a little too broad, that we are not quite focused enough, or that maybe we've aimed a little high. And I'm curious about some of the signs that you've experienced that you're involved in a collaborative effort that maybe is a little bit mired. I think somebody used that language earlier in the chat. It's a little mired or a little stuck because you've aimed a little bit too high or a little bit too broadly. What are some of the signs of that? Yep. Drop off, meetings, meeting fatigue, we're meeting again, too many possibilities, lack of clarity. Yeah, a lot here about meetings, right? I mean, this kind of collaborative work does require coordination. Meetings are part of the core of it, but I see a lot of themes here about drop off in those meetings, lack of clarity about those meetings, losing interest and momentum, updating only, also just simple like miscommunication and difficulties of coordination. Yeah, these are really good. Losing interest in the momentum. So right, or just that, you know, you have big ideas, but you don't have the resources for it. So let's go to the next slide, and I'll just identify a few of those. You've named a lot of them. That you admire the problem, right? You spend a lot of time admiring the problem. You analyze the problem. You analyze the heck out of the problem. I mean, I'm a scholar. Like I believe in data. I believe in informed decision making, but we can get mired also in that kind of like the problem is so complicated. We admire it. Sometimes too, we can't agree on how to define the challenge that we want to address. So I'll give just one example of that. I worked in the community of Falcon Heights after Philando Castile was killed by a police officer in 2016. And there was a lot of incohesion at the beginning and continuing, but particularly at the beginning about, are we talking about a police officer? Are we talking about policing? Are we talking about community safety? Are we talking about racism? Like, what are we talking about? And it doesn't need to be just one of those things, but there was a lot of kind of talking past one another and an inability to decide, although people had in many ways common cause on wanting things to get better, a lot of incohesion and incoherence about what that actually meant in terms of defining the challenge. Competing priorities too about where to focus. So you may have a group of people who have a common care, but can't agree on the where to start. Or as some of you have said, it's not clear who's going to do what, right? We can't decide on the steps. You can't actually kind of get to an actionable plan. Sometimes you have these overambitious goals, and then a lot of what you've been saying too about participants are sort of drifting away or dropping out, or you failed to really contextualize yourself. You're not key stakeholders. You're not connected to the key stakeholders. Those kinds of issues can happen as well. So let's go to the next slide. Okay, so this is where we get to the core of the argument about starting small in order to be able to innovate and then scaling up from that. So the approach that the Center for Integrative Leadership has developed is really a strategic approach that is meant to help people navigate the overwhelm. And it begins with starting small. It starts particularly with tailoring your initiative to what you can do. And I want to say that again, it has to do with what you can do. It is not resting on waiting for those people over there to do the thing that you wish that they would and you feel that they should do so that you can do what it is that you need to do. It does not mean that you stop advocating and pushing and communicating the need for those things and coordinating that work, but it doesn't make you beholden to waiting for that context to become more conducive. It really is a focus on what can we, this group of people who've decided that we want to do something together, or this group of people that I can imagine helping to be part of bringing together to work on something, it focuses on what we can do and where we can work. And I want to just say that that is not at odds with going big. It's not at odds with making a major change. It's actually a strategy for getting from something that is actionable, tractable, doable. You can monitor it. It's lower risk that you can do right now in order to get to that larger scale change. So let's go to the next slide. And the idea is that, it's a balance of not losing track of a big idea, but helping you to like get beyond that big aspirational goal, to work backwards from it to something that is small and tractable so that you can get to action on it now. And it requires a certain discipline with other people. And I'm not saying you don't have this, but it requires collectively a certain discipline about being realistic about what your connections and your resources are, but also your credibility, and what it is that you can be connected to do. So I will give another example. I have worked with folks who are highly motivated to solve a problem that they see affecting other people. And it comes from a very well-meaning place, but they are not actually connected and credible and informed. And they do not have the authority, and they are not seen as trusted partners in that place, right? So it also involves being realistic about, again, what can we do? Not what we can do on other people, not we're waiting for those people over there to do something, but what can we do right now about the thing we care about? Another big challenge of this is that we don't punish failure if those actions fail. Part of starting small is about reducing a little bit of the risk of making a big bet and then being bought into, we've done all of this analysis, we've done all of this preparation, we have lined up all of those resources, and now it has to work, or we are going to be so embarrassed. We're going to be in trouble if it doesn't work. So starting small is actually about reducing some of that risk and not only accepting, but expecting that most likely a lot of things that you try will not be very successful. So it comes from a little bit more of an experimentation mindset. Let's go to the next slide. So this is a link to the resource that we wanted to share. I believe this went out on the invitation from Brandon. And it is a short write-up in the Stanford Social Innovation Review around an approach to cross-sector initiatives and starting small that involves something that my colleagues Vanessa Laird and Miles Shaver and I have described as a minimum viable benefit. Thanks, Brandon, for putting that into the chat as well. There's no paywall for that, so you should be able to just open that link and get the article if you'd like to. So let's go to the next slide. Okay, the font here is small. I really do encourage you to look at the article, but I want to just walk you through it very briefly. It's really a cyclical process that takes people through 8 steps of really thinking carefully about how to get cross-sector initiatives off the ground by starting small. And again, it starts with who are we? What does our group have to offer? What can we do? It takes you to the next step of thinking, like, what are these challenges that we're passionate about? Getting realistic in the where step about the regions and communities in which that group of people that you're involved in is realistically affected. Now, I'm going to assume, because a lot of you are collaborative professionals already, that you have a lot of that work already thought through and that this is very familiar to you. But it's when you get to that what step that sometimes I think things do get hung up in some of the signs of stuckness that you were just mentioning in the chat earlier. What is the specific need or the opportunity that we're placed to work on? What kind of landscape analysis do we do in the factual foundation step that's at the bottom here? Data collection, data analysis, maybe asking your colleagues at Extension for help with some parts of that, right? But a landscape analysis that says, okay, if part of the benefit of working cross-sectorally or interprofessionally or collaboratively is that we get to innovate, then part of the innovation question is who's already doing this and where are the gaps? So I want to give you a great example from a group of professional students I worked with last semester. They were very, very concerned about unhoused populations, and they were particularly concerned about the impacts of homelessness and housing instability on children. And there are some really great coalitions in Minneapolis, which is where they wanted to focus their work, that are already working on various aspects of housing stability and children. But one of the things that was not really well addressed was the implications, the downstream implications of eviction on children, and particularly their educational stability and their falling behind in elementary school because they're moving among schools or they weren't able to attend school, or maybe they just didn't have some resources in like a conducive environment at home to allow them to rest and to show up at school and to keep up with their schoolwork. And so that group identified a very specific part through this landscape analysis of a small thing they could do, which was to provide high dosage tutoring opportunities for small groups of kids, 3 to 4 kids at a time, in a pretty resource intensive way, but a really focused way to say within that whole landscape analysis, this thing, because of who we are and what we care about and our relationships and our experience, many of us as educators, we can focus on this one piece of helping elementary kids who are facing eviction to stay a little bit more in the flow with their schooling, right? So finding that little piece you can work on. That's how you kind of get to defining what your minimum viable benefit project is, what that minimum piece is, and then really getting into the implementation piece of it, but also building in from the very beginning the expectation that sometimes these things don't work very well. And so you're going to have to pivot what you're doing by assessing it, or possibly scale up because it's extremely successful, or maybe stop because you've just demonstrated through this low risk, small experiment that it's not having the kind of impacts that you hoped it would. So let's go to the next thing. The next slide. So I just use the language of a minimum viable benefit, and that's the approach of that article that's at the link in the chat. I want to just explain what a minimum viable benefit is, and then we're going to stop and have some questions, and then I have some questions for you as well. A minimum viable benefit project is like a minimum viable product in the business sector. So for those of you who are more familiar with the business sector, an MVP is like the idea of, prototyping something to have an opportunity to test it, that you've developed because you've done a lot of research, and you feel like if I pull this lever, I will get this result. You've done that research. But a minimum viable product is a lower stakes way of trying that out. The minimum viable benefit is our name for doing that in a social innovation space of collaboration and trying to produce public good. But if I can just go back to the business sector for one example, Zappo is like this. If you ever bought shoes through Zappo, Zappo did not start by going out and buying millions of shoes and doing a lot of research on which shoes people most buy and what the price points should be. Zappo began as a website to test the proposition that people would buy shoes online without having tried them on. So initially Zappo was set up and they didn't have any stock at all. They got orders, they ran out to another shoe store, bought them, and sold them back to people at a loss. But it was a minimum viable product because they were testing the idea that if we set up a website, people will use a website to buy shoes. And then once they had established that minimum step was viable, then they started doing the research on, well, which shoes are people buying most often, what styles, for what purposes, in what sizes. And then they started building up their own stock of things. But the first step was all of that research doesn't matter if nobody's going to use a website in order to buy shoes that they haven't tried on. So the same idea applies in starting small with social innovation. What is that small thing that you have to establish is correct before the rest of it will open up for you? And once you've established that that does work, then you can keep going on to something bigger. So it's really for startups with limited resources, and it's a structured experimentation process. And that is those 8 steps that I was just looking at in that structured experimentation. And it's really intervention that you think you can accomplish as a group to test a hypothesis. Let's go to the next slide. It helps you to lead to greater traction to take this approach because it focuses on what you can do, not what you can do if other people over there will do something. And it helps you to get beyond some of that analysis paralysis, sometimes it's described as, right? It helps you to substitute some of the planning efforts that would go into getting everything just right to learning by doing. And it allows you to get to what's in that bottom point there, more focus on what did we learn, and then adjusting based upon that prototype. So it helps a little bit to redefine success and failure, not as like a global assessment of, oh, this is a great approach at all times. It really is a very contextualized in this place at this time, given who we are, the resources we have, our motivation, what we care about. This is what we can do right now. We think it'll work. Let's give it a try. And before I open for questions, I just want to share a personal example of an MVB approach that I've been involved in recently. And that is, we have a genuine, terrifying, terrible human crisis and civil crisis in Minnesota right now. And I feel in many ways that there are like three choices that I might make about that. One of them is I think I could just become so utterly overwhelmed by everything that I could pull the covers over my head and doom scroll, or just shut down and do nothing because of pure overwhelm, which is a highly functional response, actually, that I think a lot of us are having right now. It's a lot. I could also go to the other pole of like running around trying to do everything and working myself into such a frenzy that I would literally collapse in exhaustion. I have chosen, and this might be not the judgment that some of you would make, I have chosen to turn off rapid responder alerts on my phone and to say, who am I? Who are the people whom I'm connected with? And to lean into work that I've been doing with a group of 20 or 25 trusted colleagues and neighbors for about a year, that is grounded in my own experience of 12 years of working with law enforcement and communities on trust between local police departments and community members, and to say, I'm going to focus on separation ordinances and sanctuary cities policies, because I believe, and I think there's a lot of actually nonpartisan belief as well, that keeping local law enforcement out of federal immigration enforcement is a really good thing for everybody's safety. I've decided that like that small thing in the middle of all of this that's going on is the thing that I can focus on. And honestly, in some ways that is selfish. I mean it for community good, for public good, but is also about staying small enough to actually be able to sustain, but doing it in community as well. So I don't know if that example is helpful to others, but I thought I would just share a personal example. I have been talking a lot. I think that we should now go to Q&A, and I'd like to just open it for questions. And Brandon, maybe we could stop sharing sharing slides so that we can see each other and just engage in some dialogue and Q&A. Holly, you're muted.
Thank you so much, Kathy, for talking us through that. And right now, I haven't seen any questions in the chat. I did see kind of a note earlier from Michael Darger, just realizing, that what's going on right now is bigger, but don't let it drive you from what you can actually do. And we just heard an example of that from you. We invite people to put questions, comments, thoughts in the chat, but we also invite you to unmute if you'd prefer to ask your question directly. Any questions so far? And Kathy, I'll start with one, as maybe some others are thinking about. As you think about the model itself, and you think about timing, we're talking about starting small, we're starting about moving a little faster. How quickly do you get from the beginning to that minimum viable benefit?
That's such a good question, Holly. I think you would be able to get to this in a more accelerated way, but we usually encourage people to spend about 3 months or so kind of building connections, having some of those dialogues, moving from that big why that you might share in common to really thinking about, well, what can we do? And of course, some coalitions already exist, so this might be a reset for some. And then we really encourage people to think about that, like planning, launching, and evaluating your first effort of the MVB, which is like an MVB 1.0, and then there might be a 2.0 and a 3.0, to kind of get through that process within 6 to 12 months. So this is not, hey, let's plan to address our senior housing crisis in Stearns County. And that's going to take 10 years or 20 years, and we'll figure out how it goes. This is like, let's start with something, give it a shot. And a year from now, expect that we will have learned something and know, should we keep going? Should we iterate this and do more of it? Do we need to make a small change in it, or was that just like, that did not work? We need to reboot altogether.
Thank you. David Kay, you have your hand raised. We'd love to hear from you.
Yeah, thank you very much. A lot of very thoughtful ideas and some real wisdom that I think we all need to think through. What my question is, so you're an academic. Many of us here are involved in the cooperative extension system and working with communities. I wonder if you have any kind of emphases or framing about the positionality in a sense that we take as academics and or extension people working in community, because at least maybe you already did this deliberately or not. I mean, I didn't hear anything very specifically in what you said that I took, or maybe a better way to put it is like I could use everything you said in every context with every hat I wear that has an organizational element to it. So I'm looking for, is there something special that you think as a message that you're bringing to us that we could take back into our university affiliated roles?
Yeah. David, that's such a good question. I do tend to think in terms of general frameworks that I think a variety of different groups could use. And I do think there's a particular place for extension in helping to convene and being a partner, providing particular kinds of skills and resources in collaborative networks to work on water resource protection or youth development or whatever it may be. And I think that's why I would encourage you to think about who you are. And of course, as you just said, you could imagine yourself using this framework wearing a variety of different hats. And I would encourage you to, all of us to be complete people as we do that and not silo ourselves too much. But, what is the thing that you were best placed to kind of foreground in that space? And that's partly why I shared the example of the work that I do on separation ordinances. I deeply respect what my neighbors are doing right now with mutual aid. And I deeply respect the kind of work that policy professionals and lawyers are doing and all of those things. But I think right now, I'm a professor. I have a particular platform. I have a particular privilege. I have years of research experience. What can I do with those resources? What can I do with some of that positional authority that actually plays to my best contribution at the moment, without any judgment whatsoever about whether that's better than what anybody else is doing? It's just like, okay, what is my lane right now? And sometimes in the middle of overwhelm, I think it also is a question of personal discernment of like, what is the thing that is also laid on me sometimes, right? Like, what is the thing where I'm like, truly, in some of the conversation earlier, I was seeing in the chat, why do we try to do these things anyway? Because if we don't, who will? Sometimes there's clarity about like, that one has my name on it. And whether I want to or not, it seems pretty clear that that's how I need to step up. So I think I gave a somewhat generic answer.
Okay, thank you. I appreciate that
Yeah.
sort of response to my question. I do.
Yeah. Scott, I see your question. Such a good question, the reflexive risk aversion. I think it is high in government and nonprofits. I also think that risk aversion is actually sometimes high in business environments, but in different ways. And that's one of the reasons why in cross-sector work, you really do need to have those foundations of understanding one another's timelines, motivations, resources for thinking about risk aversion. But I hear you, and I've worked with a lot of folks in government on thinking about MVB approaches and this feeling of like we can't take the risk. And that's where actually I think the going small piece helps a lot. The going small piece, for one thing, it can sometimes fly a little bit under the radar. And so it's not something where you're going to kind of get hit in the knees if it flops. I think, that there is that reflexive risk aversion, particularly in government work, because you have a community responsibility, you have a public accountability, you should be transparent. There are high expectations you're using public resources. I think there's some tolerance by the public as well for government to innovate and take some risks. And so it's particularly when you're not talking about like, we're going to go whole hog on something. You're going to try it a little bit smaller And maybe you just sell it as something that it's going to be quiet too. We're just going to try it. And if it works, then it's a success for everybody. But I think part of the risk aversion is also talking about the risk of aiming too high, making a big bet. And we've seen those that flop. It depends on which risk you're talking about. But you and I can talk about that offline more. I'm curious to know your thoughts about it too. Is there another question?
There's a couple of questions in the chat. One might build on the one that you just shared, but Shannon asks, what do we all work together? How do we all work together to get funders to support
MVBs? Yeah, Shannon, that's a really good question. I've had some early conversations with people who are involved in philanthropic organizations about this kind of approach. And I think, there are a number of philanthropic groups in Minnesota, big ones, that are really interested in promoting leadership and innovation, who are also taken with this idea. And I think part of the message we can send to them is that a lot of leadership investment, like investment in leadership development, is a little bit more oriented toward individual leadership capacity and helping people who maybe don't view themselves as leaders to step into those roles. But we also need investment in this like playground sandbox space of people trying to work on these things together. To be honest, Shannon, I don't think I have a really great answer to that right off the top of my head. And I would love to connect with you offline to give that a little bit more thought. But I think when I do talk with philanthropic organizations, they're actually pretty taken with this, and that it actually does play into the collective impact language that has been common in philanthropic organizations for at least 10 years now, about how do we get something that's bigger than the sum of the parts. And that there are philanthropic organizations that are really going big on big bet. I mean, if you don't know the big bet language, if you just Google that, you're going to see that that's a big debate and conversation right now in philanthropic giving about go big or go home, or that's not a good policy. And so in that space, in that tension of people who are all in on big bets and people who are very cautionary about them, I think there is actually space to talk about some smaller scale things.
Two last questions I see, and I'm just going to name them both so you can go on. Jody asks if you could speak about the intersection of our work, extension, researchers, community leaders, and the skill set to step in. And then the next question
While you're
is,
looking to the next question, Holly, Jody, can you unmute and talk a little bit about what you mean by the skill set?
Yes, I can do that. That's just been a bit of a conversation about sometimes we may have a skill set that could benefit something, but it's not the right role for us coming from extension or the university, or even as community leaders, we might have that passion, but maybe not the skill set to step in and lead in various ways. And that's just been a conversation I've been a part of recently. And I've not been in it with you. And so I was just curious if you had a thought about that.
Yeah, and I appreciate so much you asking that, because I know that you have really incredible skills in facilitating, convening, bringing collaborators together, helping collaborators to be successful. And sometimes I think within leadership and civic engagement, within our unit in extension, possibly the expectation is that we set the table so that others can work together more constructively. I think it really is a place for that, but our skill set goes beyond being conveners for others to do the work. I mean, I think a big part of what we can do is help to call the question, help in that space of we have a common why, but we don't have a clear what, or we're getting stuck in the prioritization of what is our focus area, to aerate that conversation of, before we get invested in, I know what I want to have happen, and they know what they want to have happen, and we can't find common ground, to roll it all back a little bit, to aerate what is the issue we're dealing with to begin with, and help people get to that more clear, shared, common cause that's actually actionable. I think that's one of the things we can do. Does that make sense, Jody?
Oh, I appreciate that, the way you framed it and named it. And about, the setting the table and maybe the convening of people and helping build the capacity of others to use their gifts and skills as well, to weigh in on whatever those things are, is so important. So
Right.
thank you. Thank you.
And Kathy, the final question we have as we begin to wrap up, and I think you have some questions to leave people with. How have you seen the arts promote cross-sector collaboration? Any practical steps, advice, and leverage? I thought you might want this one.
Yeah, partly because I find art so art and creativity and artists and the art community so uplifting myself. Like I don't want to put that burden on people or just make it sound like it's all romantic and easy. There's a lot of work in that, but I think cross-sector work benefits a lot from metaphors and imagery and storytelling and things that maybe take us out a little bit outside of some of our initial problem definitions or our initial analytic skills and dispositions as we're trying to work interprofessionally. And I do think that the arts often help people to move out of that a little bit and reimagine some possibilities, perhaps have a little bit more empathy in different ways. I'm not an artist myself, so I don't understand exactly how it works, but I absolutely have seen that. And certainly, I've also seen a number of really effective placemaking cross-sector collaborations around community development, community pride, community cohesion, a sense of history, recognizing our history and not neglecting that really are arts led, but that do involve also not only individual artists and communities of artists, but businesses and governments and nonprofits collaborating together.
Great. And Kathy, do you have some questions you wanted to leave?
I do. Thank you. Brandon, can you throw those up on the screen for us? And these would be parting questions that I have for you. Wonderful. Thank you. I see them in the chat. These are the questions I would ask you as provocations to really think about as we've talked about scale and overwhelm and going big, going small. How do you know if you are going big or going small? Those questions that Brandon's just put into the chat. How is your scale of effort working for you or against you? Are you encountering some of those signs of overwhelm? Are there ways in which you could scale down or right size in some way? And then the second question would be, going back to the question Scott Butel asked about risk taking and risk aversion, is there anything you can do to encourage a little bit more starting small and taking risks? So thank you, Holly. I know you've got some comments to take us out.
Great. Well, thank you again, Kathy, for joining us and for sharing your work. And thank you all for joining our webinar today. A follow-up email will be coming with the video when the video is posted for reviewing. And if you're interested in past or future webinars, you can find more information at the CD Exchange. And I think Brandon has put that in the chat already. We can do that again. Thanks again to everybody for joining us. Stay resilient, take care of yourself, and have a grateful day.